you a breastfeeding mother wondering if it's safe to take Zicam? In this video, I'm going to discuss the safety of taking Zicam for breastfeeding mothers and provide tips on how to take it safely. Is it safe for a breastfeeding mother to take Zicam? The short answer is, it depends. According to the American Academy of Pediatrics and the World Health Organization, breastfeeding mothers can take Zicam cold remedy as long as they are aware of the potential side effects that may occur in their baby or infant. Zicam contains zinc gluconate, which has been known to interfere with a baby's ability to absorb certain nutrients such as iron, calcium, and fat-soluble vitamins. Therefore, if you are nursing your baby while taking Zicam, it's important to monitor your baby's diet closely and make sure they are receiving adequate nutrition. Additionally, some babies may have an allergic reaction when exposed to Zicam via breast milk, so it's important for mothers who plan on taking the medication to speak with their pediatrician first. In general, it's recommended that breastfeeding mothers try other methods of cold and flu relief, such as drinking plenty of fluids, getting adequate rest, and using humidifiers before taking Zicam if possible. Ultimately, it is important for a mother to weigh the potential risks versus benefits associated with taking Zicam while breastfeeding and discuss her options with her doctor before proceeding. What are some potential side effects for a breastfeeding mother taking Zicam? It is important to note that the potential side effects of taking Zicam while breastfeeding are not well known. However, it is likely that any side effects experienced by the mother will be transmitted to the infant through breast milk. Possible side effects may include headaches, nausea, dizziness, increased heart rate, and blood pressure, as well as difficulty sleeping. It is also possible for infants to exhibit an allergic reaction or rash after consuming Zicam and breast milk. If these symptoms occur in either the mother or infant, medical attention should be sought immediately. As a precautionary measure, doctors typically recommend avoiding the use of Zicam while breastfeeding. Are there any breastfeeding-specific risks associated with taking Zicam? Although the active ingredients in Zicam are generally considered safe to take while breastfeeding, there is not enough research to confirm that no trace amounts of the drugs can pass through breast milk and affect a nursing baby. Therefore, it is best for breastfeeding mothers to consult their healthcare provider before taking Zicam, as they may be able to provide more accurate information about potential risks. Furthermore, because Zicam has not been tested on pregnant women or children, it is important for these populations to discuss any concerns with their doctor before using this medication. It is also important for nursing moms to consider how long they have been taking Zicam before deciding whether or not to continue breastfeeding. If you have recently started taking Zicam and have been breastfeeding for less than 2 weeks, the amount of the drug in your body may be low enough that it's unlikely to have a negative effect on your baby. However, if you have been taking Zicam for a longer period of time or are close to weaning, it is best to discuss any potential risks with your healthcare provider. Are there any risks to the baby if the mother takes Zicam while breastfeeding? Yes, there is a risk to the baby if the mother takes Zicam while breastfeeding. The active ingredients in Zicam may pass through breast milk and could potentially cause harm. It is recommended that mothers who are nursing avoid taking Zicam until further research can be done on its safety for infants. Furthermore, women should always consult with their healthcare provider before taking any medication while breastfeeding. For those who must take Zicam for a medical reason, the American Academy of Pediatrics (AAP) recommends that you pump and discard your breast milk for at least 96 hours after using the product or take it just after breastfeeding so as not to expose your baby to its ingredients. If you choose to take it while breastfeeding, it is important to watch for any signs of reaction in your baby, such as vomiting, diarrhea, or irritability. If you notice any of these symptoms, it is important to stop taking Zicam and contact your healthcare provider right away. What dose of Zicam is recommended for breastfeeding mothers? The recommended dose for breastfeeding mothers is the same as for any other adult taking Zicam. If a breastfeeding mother chooses to take Zicam, she should consult with her healthcare provider first and follow the instructions on the product label regarding dosage. It's also important to note that there are no studies determining if Zicam passes into breast milk or if it has an effect on a baby while they are nursing. Therefore, caution should be taken when considering taking Zicam while breastfeeding. It's always best to consult with your healthcare provider before using any medications, especially while breastfeeding. Your doctor can help you weigh the risks and benefits of taking Zicam while breastfeeding and make an informed decision about whether it's the right choice for you. Are there any drug interactions that should be considered when taking Zicam while breastfeeding? Yes. It is important to be aware of the possible drug interactions between Zicam and medications that may be taken while breastfeeding. If you are taking any medication, it is important to talk to your doctor or pharmacist about the potential for interactions with Zicam before taking this supplement. Some medications, such as antacids, antibiotics, and certain heartburn medications can interact with Zicam and could reduce its effectiveness or cause side effects in both mom and baby. Additionally, it is important to watch out for signs of allergic reaction when using Zicam while breastfeeding. If you experience difficulty breathing, swelling of the face or throat, rash, hives, or any other severe reactions, seek medical attention right away. Are there any special instructions for taking Zicam while breastfeeding? Yes, there are special instructions for taking Zicam while breastfeeding. It is important to check with a healthcare professional before using any type of OTC medication, including Zicam. This is especially true when it comes to nursing mothers and their infants, as medications can pass through breast milk and affect the infant's health or development. If a healthcare provider has approved the use of Zicam while breastfeeding, some tips include: take Zicam at least 2 hours after feeding your baby. Keep track of which side you nurse on last so that you can make sure not to take Zicam on that side until after your next feeding session. If possible, try to plan ahead by taking the medication at least 2 hours before your next feeding. If you miss a dose, wait until after your baby's next feeding session to take it. Monitor for any changes in your infant's behavior or appetite after taking Zicam. If you notice any unusual reactions, contact your healthcare provider. We hope this video has helped you understand the safety of taking Zicam while breastfeeding. As always, it is important to consult with your healthcare provider before deciding if any medication or supplement is right for you and your baby. If you have further questions about medications and breastfeeding, please leave a comment below. Don't forget to subscribe to our channel so that you can stay up to date on all the latest health information. Thanks for watching.